1. Defects in immune system linked to malnutrition. GS Paper 1, Issues relating to development and management of social sector, services relating to health, education, human resources. Why is it in news recently? Even with a healthy diet, defects in immune system function from birth could contribute to a malnourished state throughout life, a new study suggests. Researchers targeting immune pathways could be a new approach to reduce the poor health and mortality caused by under- and overnutrition. Concerns. The most common form of undernutrition globally is stunting, where children fail to achieve their full height potential. Despite looking healthy, children in developing countries who are stunted in height may also have stunted immune development, making them more vulnerable to death by common infections. The consequences of the undernutrition. This intergenerational cycle of undernutrition transmitted from mothers to children greatly impacts on India's present and future. Undernourished children are much more likely to suffer from infection and die from common childhood illnesses, diarrhea, pneumonia, measles, malaria, than well-nourished children. According to recent estimates, more than a third of all deaths in children aged 5 years or younger is attributable to undernutrition. Undernutrition puts women at a greater risk of pregnancy-related complications and death, obstructed labor and hemorrhage. Undernourished boys and girls do not perform as well in school as compared to their well-nourished peers, and as adults they are less productive and make lower wages. Widespread child undernutrition greatly impedes India's socio-economic development and potential to reduce poverty. What needs to be done to address this issue? There is a need for high-impact interventions in national level. 1. Timely initiation of breastfeeding within 1 hour of birth. 2. Exclusive breastfeeding in the first 6 months of life. 3. Timely introduction of complementary foods at 6 months. 4. Age-appropriate foods for children 6 months to 2 years. 5. Safe and hygienic complementary feeding practices. 6. Full immunization and biannual vitamin A supplementation with deworming. 7. Adequate nutrition and anemia control for pregnant and breastfeeding mothers. What can we do? Leadership at the highest level ensured that priority is given to child nutrition outcomes, with large investments in nutrition interventions and poverty alleviation strategies in the context of rapid economic growth. Targeted nutrition interventions to prevent and treat undernutrition as part of a continuum of care, particularly among the most vulnerable children and women. Reliance on community-based primary health care as the delivery system to ensure high coverage with essential nutrition interventions for the youngest children, adolescent girls, and pregnant women. Strong supervision, independent monitoring and evaluation, and knowledge management to provide the evidence base for timely and effective policy, program, and budget reaction.